Last, we're going to have Dr. Sumeet Teotia, who's going to talk a little bit about liposuction and kind of the refinements and dispel some of the myths.
Thanks for sticking around. Well, I guess I'm going to talk a little bit of liposuction. It's been touched, fat has been touched as a subject by everybody here. Dr. Kenkel, Dr. Orick, Dr. Pessa mentioned that fat is ubiquitous. And liposuction generally is about removing fat rather than adding fat. And there's several ways of doing it, but one of the myths is that if you liposuction one area, is it going to come back exactly the same place, or does it go somewhere else? It's one of the most common questions patients ask us. Well, you know, if you gain about 30% weight after a liposuction, it's going to come back everywhere, including the area of liposuction. Probably a little bit less, but you know, so I think that's one of the myths that no, it will come back if you maintain your lifestyle, and that's something that was touched by Dr. Kenkel in body contouring. Liposuction, when I see patients, when we all see patients, it ties into lifestyle issue. It's a lifestyle operation. It's an invasive operation that requires general anesthesia, and there are several ways of doing it, whether it's ultrasonic liposuction or traditional liposuction. So it has real risks, and it is a real operation. And you know, the other is how much are you going to remove in terms? Well, I personally say I remove as long as my right hand doesn't get tired, and I have to switch to the other hand. But no, but. You know, you hear about...
Is that a good rule?
Well, that's what I tell my patients, which means less than 5,005 liters. But, you know...
What if you're ambidextrous?
No, I think I just do it.
Okay.
But, you know, you hear about large volume, low volume liposuction. You know, anything above 5 liters or 5,000 cc's is pretty large.
Or
and
10 pounds.
You know, that's a lot of fat. And, you know, people do over 10 liters, not very safe. We do it under safe general anesthesia, and I think that... You know, if it's a few liters, I think is acceptable. I tie that into what they do. They have to exercise. They have to tell me that they're within about 5 to 10 pounds within their ideal body weight. Only then it's going to tie to lifestyle issue. Otherwise, the effect is not going to be that great. There are other newer technologies that has non-invasive. Dr. Kenkel talked about laser, and you know, there's a new device called Zerona. It's a non-invasive. Laser, it does not dissipate heat, and so it is a liposuction as well, and it requires 6 treatments and low downtime, but there are certain limitations of that procedure, but that is not done under general anesthesia. But it's probably one of the most common things, liposuction. Mm-hmm.
It is the most common operation we do.
Yeah.
Yes?
Do you do liposuction for lymphedema yet?
No, because liposuction will disrupt some of the lymphatics, and it crosses zones of different portions of the body. So localized areas are best, like flanks on the side, young people underneath the chin. So those tend to be a little bit, you know, more amenable to liposuction. So not all areas, because all fat is different everywhere. All areas don't respond necessarily, and you know, it's a real surgical procedure. So.
Lymphedema is best treated by compression pumps, and, you know, and there are pneumatic pumps, and that treats it the best.
I do that 4 hours a day.
How's it work? Yeah. So, any other questions for Dr. Teotia?